Break in progress.
All right. Nurse 176 exam 2. We're all a little worried about this one because the first one was such a crock of shit and a lot of us didn't do as well. So hopefully we can do better on this one. I'm going to try and do a good overview. I'm going to go off kind of the exam 2 blueprint in our workbook, but also going through the review that our professor did in class. So I'm actually going to start with the meds. I came up with some of my, of course, weird sayings for some of them to remember them. Because there is quite a bit of meds on this. So I will go through those really quick and then go into the other stuff. So one of the first meds we have is the oxybutenen chloride. I'm going to murder all of these. Also known as the ditropan. It treats overactive bladder, is taken PO. So just think of an ox peeing by the side of the road is what I'm thinking of for this one. Peeing all over the road, the oxybutenen chloride. So it treats the overactive bladder. And then we have Proscarb. Is the name brand, but it's finasteride. So for this one, I put Finn is a pro at scarring babies because this is that medication that treats BPH, but that pregnant women are not supposed to touch. It is taken PO, so finasteride or Proscar treats BPH. Think of the Finn, the guy, he's a pro at scaring the babies. Then we have tamsulosin hydrochloride. It's also known as the Flomax. This is a treatment for BPH taken orally. I have for my little saying to remember this one, Tammy sold Flow Max Z-Pads. Let the pee flow. So it's kind of a combination of both the generic and trade name. So just remember flow to the max, letting pee flow. It treats BPH. And then we have Epoetin alpha. It's an anti-anemic, anemic. So it treats anemia. Taken sub-Q. Think of alfalfa. I didn't really think of a good one for this, but like that's the hamster eating alfalfa to get his iron. So Epoetin alpha, anti-anemic, anemic, can't talk, to treat anemia. Then we have what we know very well as the potassium sparing agent, but we all know it as the Caxolade. But we have to know the generic name. So sodium polystyrene sulfonate, a really long name. So it is a diuretic. All that. All right, I lied. I'm not paying attention. So this one is the potassium removing agent. So this is the one that binds to potassium and you poop it out. So sodium polystyrene sulfonate, also known as pentaxacate. So it binds to the potassium in the colon and it ends up pooping that out. So it treats hyperkalemia. It is given PO or rectally. I don't really have a good one for this one. Instead of having sodium, I put Na polysulf. Just trying to break it down into littler words. But I think we'll be able to remember this one because it is such a long word. Then we have polyethylene glycol or Miralax. It is a laxative. It treats constipation. So I put poly means lots of, glossy BMs. It is taken PO. We also have Senna or Senecot. It is a stool softener taken PO. I put Sins of a BM on a cot just to try to remember both the generic and trade name. You have Docusate, which is Colace. It's another stool softener taken PO. So pretty much all of these stool softeners are PO. I feel like we all pretty know that one. We have trade name Bactrim, but a generic name is trimethylprim sulfamethoxalone. Lord, whoever came up with these names. It's anti-infective. It's used to treat UTI. For this one, to remember the generic, I said if you try meth, you might get a UTI. It is taken PO. And then you have nitrofurantoin or macrodantin. It's another medication that treats a UTI. It's taken PO. I put nitro infused fur caused a UTI. Sorry, dog barking. Anyway, so nitrofurantoin or macrodantin treats UTI. Remember, nitro fur caused a UTI. And then we have infliximab, word, or Remicade. It's an immunosuppressant. It's used to treat Crohn's or ulcerative colitis. It's a remedy for colon issues. Just think they were inflicted with Crohn's or ulcerative colitis. And then we have metronidazole or Flagyl. This is to treat bacteria of the vagina or stomach. It's given PO. I put they played flag football in the Metrodome, but got a bug in their stomach. That's how I'm trying to remember this one. So it's just one of those antibiotics, Flagyl or Metrodome, or now I'm thinking of saying metronidazole. All right. Then on to more medications. We have furosemide or Lasix. That's the loop diuretic. It treats edema. It can be given PO or IV. So I kind of combined my saying to remember both the generic and trade name. So I said there's no time to lace shoes. Fur on my coat will get wet because I have to pee so bad. So it has the Lasix and fur in there to try to remember those things. I know my sayings are weird, so if this doesn't help you, that's fine. I don't take offense because they are really weird. Then we have spironolactone or aldactone. I'm murdering the names. Sorry, guys. It's another diuretic that's used to treat edema and hypertension. Given PO, I put Aladdin spiraled on the magic carpet and peed himself. Then we have the hydrochlorothiazide or microzide. It's an antihypertensive, so it treats hypertension and edema. It's given PO. This one I'm just remembered because there's so many elements and a long word to this as well that micro and hydro and chloro all rhyme, and both generic and trade name end in zide. And so I said they all reside in the bathroom because they have to pee so much after taking this medication. Digoxin or Lanoxin is they treat heart failure and heart rhythms, AFib. It's given IV or PO. The therapeutic range we might need to know, but I'm not sure. So it's 0.5 to 2.0. So for this one, I put, so they both ended XIN. So Zin the Diggers heart rhythm changed after digging 0.5 to 2 feet underground. Then we have nitroglycerin or nitrostat, which I feel like we all know nitro pretty well. It's a vasodilator, treats heart failure, MIs, stable angina. It can be given transdermal, IV, sublingual, or even intracoronary, which we didn't really talk too much about that one. Remembering nitro, you're going to give about every 5 minutes, 3 times. And if it doesn't work, then you need to get to the hospital. It should relieve the angina and other symptoms that they're having. Then we have metoprolol or Lopressor. It is a beta blocker. It treats heart failure, angina, hypertension. It is given PO or IV. I put beta met Lois and blocked her way to hell. Don't know why I came up with that, but that's what I came up with. Like I said, some of mine are really weird. Then we have diltiazem or cardizem. It treats hypertension. It's given PO. I put Cardi B dialed for them or Zen to come lower her blood pressure. And then we have lisinopril or Prinavil. It's also something that treats hypertension and given PO. So these both that treat hypertension given PO. I put Lisa said no to stress and lowered her blood pressure. Atorvastatin or Lipitor. There's TOR in both of those, the generic and trade names. So that treats increased cholesterol. It's given PO. So I tore through the bag of chips and it increased my cholesterol. So since it deals with cholesterol and it has TOR in their names, that's why I chose that saying. Enoxaparin or Lovenox treats MI and pulmonary embolisms. It can prevent DVTs. It's given IV subcutaneously. For this one, they both have ox in the name. So I put the ox made her bleed. Aspirin or Ecotrin, which I've never really heard it said that way, but anyway, aspirin is an NSAID. It treats mild to moderate pain and it's given PO. I feel like we all know aspirin pretty well. Clopidogrel or Plavix prevents stroke. MI is given PO. So it starts with CLAP. So I said CLAPs do help the heart. Apixaban or Eliquis is anticoagulant. Prevents blood clots. Is given PO. I put a Apixaban clots. Also Apixi and Eliquis kind of rhyme. Apix and Eliquis. Those rhyme. So it's kind of my way of remembering the trade and generic name. Remember, if they're on this, you want to use like bleeding precautions, such as using soft toothbrush and things like that. Next drug we have is cyanocobalamin or Nascobal. I'm terrible at pronouncing things. This is that vitamin 12 deficiency medication. It can be given intranasally, PO or IV. I put prevent cyanosis, give a ball of B12. I'm so weird, I know. Hydroxyurea or Hydria. It's like a chemo, can treat melanoma or sickle cell anemia. It's given PO. I put hydrate the sickle cells, then P or urea the anemia away. And then our last one, thank goodness, hydromorphone or Dilaudid. It's an opioid, moderate to severe pain. Is given PO, IV, or IM. I put morphone for more hydrodilate dildo pain meds. I don't know what's wrong with my brain. All right. I will send a picture of all my little sayings if you guys like them. If not, don't worry. I don't blame you. I do have in front of me some of the lab values that we'll probably need to know for this exam. They've been wanting to throw those in there. So remember, this is just a review. Potassium 3.5 to 5. A BUN normal range is 10 to 20. I think of 1 to 2 buns you need for a hamburger or a hot dog. Creatine 0.6 to 1.2. I just think 6 to 12-year-olds are creeps. White blood count is 5,000 to 10,000 normal range. Hemoglobin is 12 to 18. I just think 12 to 18-year-olds for Halloween like to dress up like goblins. Platelets 150,000 to 400,000. I have not come up with a cool saying for that one yet. PTT is 25-35 seconds. Therapeutic range for INR is 2 to 3. BNP should be less than 100. A higher level does signify worsening heart failure. So that's what they look at for that. Albumin is usually 3.5 to 5. Urine specific gravity. I don't know that we'll need to know that, so I'm not going to do that one. EGFR. I have seen this quite a bit with our lectures. So normal is 90 to 120 milliliters per minute. And then the D-dimer I've seen a lot, so I figured I'd throw that in there as well. Should be less than 250. Those are all on our Hondros lab values. I just looked some of them up because I've seen those quite a bit, and it seems like last time they threw quite a few of labs in there. So I figured it'd be good to refresh ourselves on some of those values. All right. She also said we need to know the heart again and the flow of blood. So just a quick refresher. The blood comes from the body through the superior and inferior vena cava. It goes into the right atrium through the tricuspid valve, because it's the tri before you buy, if you remember that saying. So through that tricuspid valve, into the right ventricle, through the pulmonary valve, through the pulmonary artery, and it goes out to the lungs. And then it comes back oxygenated through that pulmonary vein, goes into the left atrium, through the bicuspid valve, into the left ventricle, and through the aortic valve, and then through the aorta to the rest of the heart again. I think there'll probably only be one question on that, and I feel like it's going to be drag the boxes in the correct order. So hopefully it's not too hard. Just remember your heart, you got to flip it, because when you're staring at the person, it's not going to be left and right. So really your right is opposite, because you're looking at them as if you're that person. All right, urinary issues. So knowing those different words, so anuria is no urine. Oliguria is a decrease in urine, low urine outputs. Hematuria is bloody urine. Nocturia is peeing in the night. Polyuria is increase in urine. And dysuria, so painful urination. The types of incontinence, you have stress incontinence. I can talk. So that's when you cough or sneeze and you pee a little bit. Functional incontinence, so it's not a bladder issue. It's due to impaired mobility. So they have a hard time getting to the bathroom or removing their clothes. So they don't function well. Think of it that way. So functional incontinence. Overflow is they're holding it. Transient is a medical reason. So they had a UTI or trauma. So another name for UTI is cystitis. The main cause of cystitis is bacteria. Some things we can educate our patients on preventing this is wiping front to back, drinking plenty of fluids, voiding after sex, drinking cranberry juice and not holding your urine. Know that cystitis can lead to polynephritis. It's a much more intense and bad infection in the kidneys. It's gone from the bladder to the kidneys, I should say. It's very severe. You have flank pain, and then you have that dysuria and polyuria. So definitely don't want it to get to that point. If they're having signs and symptoms, we want to do a UNA with CNS, so urinalysis with culture and sensitivity. You can wear cotton underwear, educate to take all their antibiotics. So even if they're feeling better, you still need to finish those. So all those types of things. So renal failure, you have acute and you have chronic. So let's see where my notes are on that one. So signs and symptoms of chronic kidney disease can be anemia, low calcium, high potassium, oliguria, hypertension, fluid volume overload. If they have high potassium, you can give them that medication we just talked about, the sodium polystyrene sulfonate. That's that potassium binding medication. And you want to put them on a low potassium diet. We didn't really talk too much about acute kidney failure, so I don't feel like there's gonna be too much on that one. So if you guys want to, you guys can just look that one up a little bit. There's different stages of acute kidney failure. There's the onset, oliguric, diuretic, and recovery. But other than that, I'm not sure what else we really need to know for this specific test. Lab diagnostics that they'll do is the BUN, creatinine, electrolytes. Same thing with chronic. You're going to look at the UA, BUN, creatinine, GFR, urine albumin. So those are all tests for the kidney function. Types of dialysis. Sorry, dog. All right, so types of dialysis. So you have your peritoneal dialysis and your, what is it called? Oh, my brain. I just had it in front of me and then it left. And hemodialysis. So your hemodialysis is done with the machine. You have to have the hold on. Oh my gosh, my dog is being so needy today. Okay. So you have a hemodialysis and peritoneal dialysis. So hemodialysis goes outside the body to a machine. It's usually done in a hospital or dialysis clinic. You have to have a fistula or graft. Then the peritoneal dialysis is done inside the peritoneal space inside the body through the abdominal wall. It can be done at home. It's an aseptic procedure. It's performed daily. So with the peritoneal dialysis, we want to educate the patient how to do this aseptically, that they need to wear a mask, how the fluid will go into the cavity and then stays there for however prescribed hours and then drained. When the fluid comes out, it should be clear. If it's green, yellow, or has any sediment, we have to alert the doctor. If it's not draining well, we're going to educate or have them change positions and check the lines and make sure they're not kinked. I think that was the main things that we needed to know. One of the things that can go wrong is they can get peritonitis, inflammation of the peritoneum. It's caused by bacteria. It can cause septicemia, hypovolemic shock, paralytic ileus, and possible organ failure. So we definitely want to keep an eye out for signs and symptoms of peritonitis with these guys. Then you have appendicitis. That's inflammation of the appendix. The opening of the appendix is blocked by stool, tumors, parasites, or seeds. It'll present, they'll have pain in the epigastric or around the umbilical cord, or umbilical region, I should say. And then it shifts to the right lower quadrant. If their pain all of a sudden goes away, that's not a good sign. That's usually a sign that it's ruptured. So that's a huge red alert, because that can lead to sepsis. We want to see what their white blood count is, because that will be elevated. Treatment is we make them NPO, laparoscopy. They'll do an incision if there's no rupture. They'll go in and take it out. If there's a rupture, they're going to give them antibiotics and fluids. Celiac disease. So with celiac disease, the main thing with that is you want to make them gluten-free. Trying to think if there's anything else major with that. Not really. I think the main thing is it's autoimmune, it affects the small intestine, and they have to go on a gluten-free diet for the rest of their life. So celiac disease. So we're gonna need to know some differences between Crohn's disease and ulcerative colitis. I have a couple of pictures that I'm going to send out to you guys. And then what she talked about, I'll go through as well. So we'll do Crohn's disease first. So it's anywhere in the GI tract. So from, just remember, gum to bum. So mouth to rectum, Crohn's disease. It can affect all 3 layers of the bowels. Can cause peritonitis and ruptured appendicitis. They have regular diarrhea. They'll usually have inflammation, normally in the right lower abdomen. And ulcers, just remember they penetrate the entire thickness with Crohn's. And it's anywhere along the GI tract. They can have surgery done. They can cut out the diseased part of the colon or the bowels, and dietary therapy. Then ulcerative colitis is not full everywhere. It is only in the large intestine and the colon. It only affects 1 layer of the colon, of bowels, and they typically have that bloody stools. Trying to think if there was anything else. Management, same things, surgery, dietary. Trying to think if there was really anything else major that we learned. Not that I can think of. The only way to treat that is removal of the whole colon for ulcerative, whereas with the Crohn's, we remove just the diseased area. Need to know our different rhythms. So there's 3 rhythms that can be fatal. Just remember those ones are the pulseless, ventricular tachycardia or VTAC, VFib or asystole. Try and get all my notes to where I have everything written down so I don't forget anything. The main rhythms we talked about. So your normal sinus rhythm is just a normal heart rate. So 60 to 100 beats per minute. It's regular, nothing crazy with those. And then you have your sinus bradycardia rhythm. So that's less than 60 beats per minute. So just think Brady is slow, so less than normal. We don't treat unless they are symptomatic in this rhythm. It is frequently seen in athletes, but it's totally normal for them. They might be dizzy, might have angina, low blood pressure. You can give atropine to elevate the heart rate. Sinus tachycardia rhythm is anything over 100 beats per minute to 150 beats per minute. This actually causes poor cardiac output. It can be caused by dehydration, fever, stress, excessive caffeine, which makes sense. They'll have palpitations, angina. You would give metoprolol, cardizem to decrease the heart rate. And also want to treat the underlying cause of what's causing this high rhythm. So treating that fever or the stress, anxiety, or even dehydration, giving them fluids. Dysrhythmia. So we need to know the definition. So it's the disturbance of rhythm at the heart caused by problems in the conduction system. Do it one more time. Dysrhythmia, disturbance of rhythm of the heart caused by a problem in the conduction system. Then we have atrial fibrillation or AFib. This is irregular heart rate. It can give you a regular heart sound and pulses. These patients need to be on blood thinners to prevent clots. They're at a high risk for strokes. We treat these guys with anticoagulants, beta blockers, and you can also do that synchronized cardioversion. So give them that little shock and it makes them go back into normal rhythm. Next one we have is ventricular tachycardia or VTAC. The QRS is wide and bizarre. The rate is fast. Patients might be awake, so you need to go in and assess their pulse first. If they have no pulse, you would start CPR. It is a life-threatening rhythm. They can go into VFib. So we'll go into that one next. Ventricular fibrillation or VFib is life-threatening. You have to do CPR and then you also must defibrillate because there's no cardiac output. There'll be no pulse and they won't be breathing either. And then the easiest one, asystole. There's no rate and there's no electrical activity in the heart. These are the patients we can't defibrillate because there's no electricity in the heart. So you would do an epi and CPR. Before you do any of those, though, you do want to check the patient and check your lead placement and make sure that is truly asystole. All right. Heart failure. So heart failure is the inability of heart to meet metabolic demands of the body due to pumping ability of heart is ineffective. Remember, you have left-sided and right-sided heart failure. Left side is lung, so think they're going to have crackles, shortness of breath, cyanosis, hypoxia, wet cough. And then the right-sided is the rest of the body. So you're going to see just jugular vein distension, edema, enlarged spleen, enlarged liver, ascites, which is your abdomen fills up as well and becomes bloated. And then the most common cause of left-sided is right-sided. So you also see the lung things as well in the right side. The diagnostic test for heart failure is BNP. Increased volume is seen in heart failure, and the higher the level, the more severe the heart failure. They might do a chest x-ray to show cardiomegaly or pulmonary infiltrates. Sometimes they do the echocardiogram, which shows quite a bit. So it shows ineffective ventricle contractions and heart enlargement, heart flow, blood flow, I should say. Medications for heart failure, the first thing they will use is ACE inhibitors. They use diuretics, beta blockers, cardioglycoside and nitrates. They usually put these patients on sodium restrictions and sometimes fluid restrictions. Complications is they have dysrhythmias, pulmonary edema, tachycardia, tachypnea, and then these guys go into the that pulmonary gosh. Hold on one more time. Oh, this dog. Anyway, pulmonary edema has the tachycardia, tachypnea, blood tinged frothy sputum. It's a severe emergency. The main thing with the pulmonary edema is that blood tinged frothy sputum. Let's see what Malik. I don't even know where I'm at anymore because his dog got stung on his eye. Hypertension. Some risk factors for hypertension is smoking, obesity, sedentary lifestyle. There's the crisis hypertension that we talked about. It's a life-threatening emergency. It's often seen in African Americans, men 30 to 40 years old. They have a severe headache, blurred vision, nausea, restlessness, change in level of consciousness. Their systolic is over 200, diastolic is over 100. So first thing you need to do is rapidly bring their blood pressure to a non-threatening level, and then you slowly get their blood pressure back to normal. You're going to want to do frequent vital signs and put safety measures like seizure and stroke and bleeding precautions on these guys. Coronary artery disease. So we kind of talked about it a little bit. Let me see if I can look at my notes real quick. It's the leading cause of death in the United States, and it leads to heart attacks. Occurs when the coronary arteries are partially or completely blocked. Atherosclerosis is a major cause of coronary artery disease. They often get angina, have decreased circulation. So when we're talking about angina, remember there's stable angina and unstable angina. Stable angina is effort angina. So if they're doing exercise or like outside mowing the lawn, they get chest pain. If they rest or take nitroglycerin and it goes away, that's a good sign. That's stable angina. Unstable angina is like she said, if you wake up from a sleep or you're at rest, you're not exercising, and you get chest pain, and it gets worsening. doesn't get better with rest or with nitro, that's not a good sign. You need to go to the emergency room. It can lead to a heart attack, or it could be a sign of impending heart attack. So those are not good. If somebody comes into the emergency room with chest pain or signs and symptoms of a heart attack, first thing you want to do is put them on a 12-lead EKG. An MI is a heart attack. It's death of the myocardial tissue caused by prolonged lack of oxygen and blood supply. So like occlusions of the coronary artery caused by a blood clot. Most occur in the left ventricle. It's usually it's a sudden onset, substernal crushing tightness, pain, very severe pain. It's unrelieved by nitro and may radiate to the back, neck, jaw, shoulder, arm. They'll have shortness of breath, decreased blood pressure, nausea, vomiting, weakness, diaphoresis, increased heart rate. So for these guys, you want to give them O2, IV, fluids, meds, monitor, do dietary restrictions, low sodium, cholesterol, no caffeine. There's the non-STEMI or STEMI, which is a total occlusion. They will do troponin levels. 3 times, I believe. They give nitro, morphine, aspirin, chewable aspirin because it works quicker. And let's see what else. Pretty much that's it. So let's go into anemia and the different types. So you have hold on, let me get to the right page. I have too many pages of notes. Iron deficiency anemia, which is self-explanatory. You have a lack of iron in your blood. So they can take iron supplements or increase iron-rich foods. So red meats, liver and fish, dried beans, dark green leafy vegetables. And then you have pernicious anemia, which is the vitamin B12 deficiency, or they're not absorbing it from the abdomen. You need vitamin B12 medications, either PO or injections 1 time a week, and then eventually they'll go down to 1 time a month. Signs and symptoms they'll both have is fatigue, shortness of breath, pale, weak, palpitations. Their exercise tolerance goes down. And then you have sickle cell anemia. That's the genetic chronic condition inherited from mom and dad. You can have the trait, but not the disease. So you can pass it on to your child. It is most common in African Americans. This is the deformed cells. They're not able to carry oxygen. Signs and symptoms is these guys will have severe pain. You want to give them fluids and oxygen and pain medications. They may need transfusions. They need to avoid triggers such as infections, cold, extreme cold, stress, smoking, and alcohol. They can have pain in their joints. And if they do start having pain in their joints, they need to call the doctor. DVT, as we all know, is the other word for a blood clot. I don't know. Here's the main things with the DVT is you want to know the signs and symptoms. So you'll have swelling, redness, warmth. Usually it's unilateral. You treat it with heparin, sub-Q or drip. And then they'll bridge to Coumadin and they'll be on both of these in the hospital to get both ranges therapeutic. That way when they discharge, obviously you don't want to be on a shot. So they'll be on Coumadin when they discharge. The prevention of DVTs is exercise, being mobile right after surgery, so getting up as soon as possible. TED hose, being on the like Lovenox, heparin. If they do have a DVT, you don't want to get them up though. You don't want them walking until they're on blood thinners because then a pulmonary embolism could happen. So you just got to be really careful with how they word those questions. Because if you're trying to prevent the DVT, then yes, you want them up and walking. But if they have one, then you don't obviously want them to get up and move around because that could dislodge that clot. And it could go to the lungs, causing that PD. Hemophilia is that disorder, the bleeding disorder. Let me find my notes real quick so I don't forget anything impertinent with that. If I have any notes on that, Lord. So it's a genetic mutation. You want to put them on bleeding precautions. They don't have any blood clotting factors, so they have really increased bleeding. These patients should not do sports. It's a hereditary disease. The females carry the gene, but the males get the disease of hemophilia. These patients should not be on aspirin, and they should not be in like contact sports. They should be using like a soft toothbrush. There's no cure, but they can get frozen plasma. It has to do with clotting factor number 8. Those are the main things for that one. DIC, or disseminated intravascular coagulation. So we kind of learned about this in 166 with the placenta abrupta. Lord, I can't talk. So you have bleeding and you have clotting. So it's a mixture of both. Your lab values, you're going to have an increase in D-dimer. I have everything spread out here. So your D-dimer, so normal is less than 250. So they'll probably give you something higher than 250. Increase PTT, so something more than 35, and increase or prolong PT-INR, so more than 3. You're going to have a low platelet count, so less than 150,000. And so low fibrogen. Let me look real quick. I don't think I have fibrogen. It's not on our sheet. So that's helpful. But if you remember all the other ones, I feel like you'll be good. So the treatment for this is you're treating the underlying cause. So where the burn or the bleed is, so that you can fix the clotting factors going to that one area. Let's see. Peripheral vascular and artery disease. Those are kind of very similar to your coronary artery disease, except it's in the vascular system. So you have occlusions in the veins or arteries, plaque buildup. It decreases perfusion. They'll have thin, shiny skin or no hair on their legs. Intermittent claudification. So that intermittent, when they're exercising, they'll have pain in their legs, but it feels better when they rest. These are the patients, the peripheral artery disease, that you want to actually dangle their legs. Gravity helps circulation, so you don't want to elevate these guys' legs. You want to dangle them. It will help with their pain. You do want to encourage exercise, just not like excessive. You want them to have low sodium diets. They need to take their meds, not smoke. You do not want to put ice on these patients either. So no ice, no elevation. So you want to dangle the legs for the PAD, peripheral artery disease. Try to miss anything. Digoxin can cause, you can have toxicity, so knowing the signs and symptoms. So loss of appetite, double vision, nausea, vomiting. I feel like I had notes on that too. Let me make sure I'm not reading certain. Way too many notes. Confusion, loss of appetite, nausea, vomiting, diarrhea, or vision problems. Okay. When they're on Lasix, you want to watch their potassium because your potassium will drop. So if they have low potassium, you don't want to give them Lasix. So that might be a question. They might trip you up. I feel like I hit on most a little bit of everything. If you guys have any questions or need help with anything, just let me know. Sorry, I had to pause and start so much. Lovely children and dog issues. My bad. But I will see you guys later.